let's get started. Hi, Abhinav. Welcome to Context.
Hey Varun, really good to be here. Super excited for today.
Yeah. Did I tell you how people keep getting mad at me for naming this conference Context? Because when we were preparing for some of these sessions, someone literally told me that, can you give me more context about context? So it's just like
Yeah.
funny
They
how
just don't have
uh,
context.
they just don't have context. But like I feel honestly, like humans need like context to do a good job. So does AI. So we felt the name was fitting, as everyone is trying to get AI. So yeah, I think it was a good name and it will keep on giving. Um, when was the last time you used Claude?
Like right now. Uh, it is insane. Like I think the amount of time that I've been starting to spend with AI, I feel my wife and kids have started questioning. Like I think who is really family to you?
Yeah, yeah, and I'm sure a lot of people like on in the audience will resonate with what I'm going to say. But it would be really nice if my cloud could just borrow all of the context from your cloud, and it would save a lot of time. I feel like most organizations will feel the same way about accessing the context from their CEO's cloud. So I hope Claude is listening and like we'll get that feature sometime soon.
Yeah. No, I just feel like I think it is as much as I think that sounds funny. Like I think the reality of how technology is basically evolving, and if base level intelligence is going to be commodity, right? Then almost everything that we have around us is just like I think context, and the more context you could feed into like I think this base level commodity like I think intelligence layer, the better you would sort of really like I think get. So I think people are underestimating like I think the entire value of context more broadly around them, and to your point, like I think earlier, it is a fitting like I think name for the conference, because it's rarely like about just the AI capabilities. It is about creating like the right kind of context for all of us to be able to do our things better, for sure.
Yeah, absolutely. And from what we are seeing, there's no shortage of AI in healthcare. But like, just to get us started, I feel that healthcare at its core is uh, about people taking care of people. It's like human, it's personal, it's also high stakes. What do you think what do you think where AI can really help healthcare? And like, as you've been talking to other leaders, what's the general take there?
Yeah, I I'd say this, Varun, right? We've spoken about this like I think quite a bit, but the reality of the way healthcare is being delivered today is that no one of us really feels like there is enough healthcare today, right? If you wanted to get a primary care appointment, it's 4 weeks out. Like I think if you and god forbid like I think something serious has sort of really happened, and you still want a referral into your specialist, it's strange where we've sort of really gotten to that after spending $5 trillion like I think on providing healthcare to all of us in the US. We're just not really getting the kind of care that all of us basically deserve. Right. And if that's basically like I think the case, like we have to think deeply about the fact that more money hasn't really like I think solved anything, right? Like because we
Mhm.
were spending $3 trillion, we are now spending like $4.5 trillion. We are projected to spend $5.5 trillion, and like in some estimates, like I think we are going to get to $7.5 trillion. But it doesn't feel like I think anything's sort of really improving. If we get to like this $5-7 trillion basically spend, it is the second, third largest basically GDP of the world. American healthcare is the third largest GDP of the world, and even after that, the NPS of healthcare like more broadly is not really at the place where you want it to get to. And so I think like you have to think very deeply around the fact that what is going wrong. Like how do you sort of really think about this, that wanting for it to get better. The intent is there, employers are spending more, government is spending more, each one of us is basically like, I think, like spending more money out of pocket, like in general, and nothing seems to basically improve. So I think the way I think about all of these things is that we've created a system over the last multiple decades, I would say, where there is so much friction in the system that you can put any amount of oil or like capital in this case into this engine, and nothing will work. Like right, like it's not about putting, like I think, like more fuel to work. It is about like fixing the frictions that have been created, like in the system. So the way the administrative cost structure is basically, like I think, like structured today, that there is more and more complexity that is being added, like in the administrative, like I think, structure of healthcare. And therefore, for close to 40, 35, 40% like of the spend effectively goes into solving for administrative complexities, rather than thinking about like how do we care for the patient. And if that's basically going to be the case, like going forward as well, we can put any amount of money. We can basically spend $7 trillion, we can also spend 10, we can spend the entire world's GDP, like I think, into American healthcare, and we will not really get a better experience per se. The
Mhm.
systemic nature in which like this is sort of really broken, like the fragmentation of information that's there, people really not being aware of what are the rules, how are they basically changing, and really feeling a lack of context to a certain care thought process. I think all of that is an incredibly challenging place that we've gotten ourselves to. And so I say this, like I think, very often, that we are talking about AI quite a bit right now, and the impact that AI can have. The reality of it is that we first need to get internet running. Like, and
Mhm.
what internet basically, like I think, like gave us to a certain extent was global context. Like we had, I don't know if you remember, like I think, like, but this is going to the library, opening up Britannica, Encarta, all of these sort of, like I think, like, things. That is how we got context of the world before. And suddenly, once the internet like happened, we created like this entire framework in which we could have had context, and we could have operated on that context like much more meaningfully, and everything got better. We got Uber, we got Amazon, we got Google, like all of these things suddenly started happening. So I think like it
Mhm.
is the same in healthcare as well, that we have massive problems in healthcare in general, like whether that's cost, affordability, experience, all of these, like I think, like problems that are there, none of them basically get solved unless we create, like I think, like a common context infrastructure which is like easily accessible, and therefore basically, like I think, like then solves for better AI, better outcomes, all of those things going forward as well.
Yeah, yeah, makes sense. Yeah, so the promise is huge, and what you're saying is that it's not really about uh, a AI doctor who's delivering care. We're essentially saying that like all of this, like 40, 45% of the spend that is going into administrative work, how do we automate a lot of that with AI so that those funds can move to delivering better care and like hiring more doctors, more nurses. Uh, and what I heard is that like the infrastructure is what we need to solve for first, like the internet for healthcare, as you put it. But like from what we are seeing, like I think almost every organization today is piloting AI in healthcare, but like there are studies which are saying that 80% of those pilots are not able to move beyond the pilot. Like some studies are even like quoting a 95, 96% number. Like based on what you're seeing, like what do you think is the gap between the promise and like the reality on ground in which like people are approaching AI?
Yeah, I think like my general view, like on this one, is like obviously, like the technology has been incredibly powerful, right? Like I think, like the ability for an a model to effectively, like I think, like learn through a large part of unstructured information, and in general, is a transformative, like I think, like technology. We've all sort of like experienced it in some ways with chat gpt, with claude, with gemini, with all of these, like I think, like things, and therefore we now know that, like, there is going to be like a massive transformation on how we interact with machines, right, like, and the ability of the machines to basically, like I think, like do different things. So because of like a lot of these things being there, there is a lot of interest and hype around the fact that, like, we should be doing ai as an organization. Now, when I go to basically most of these organizations, I don't think people really are thinking about transforming as much as they are basically thinking about like bolt-ons and add-ons, right, like,
Mhm.
can I basically put, like I think, like this one technology here and one technology there, like, so that my coding gets better, my scribing gets better, like, and the reality of it is, if you think about this incrementally, the gains are going to be incremental. There is going to be no structural change in how you deliver care. Your PNL will not look different. Like, actually, like I think, like there is going to be a net new cost structure that is going to be there, which basically now says that you're also paying for AI. Like, so the PNL is going to look worse. Your maybe, like I think, like there is a little bit of improvement here or there, like, in some experiences, etc. Maybe there is incremental dollars that you effectively create through, like I think, like coding and like all of those sort of like things, but nothing would really materially change. So what is effectively required, like, and we've basically gone through this basically at our company, like, as you know, like, the entire rewire, like I think, like framework that we effectively set up, that you have to think about this, like I think, like fairly transformatively. Like,
Mhm.
you have to understand that what are your processes, what in those processes can be done, like I think, by a person and should be done by a person, and what in that process needs to basically be, like I think, like offloaded, because it's just administrative like work, and someone else can basically, like I think, like do it better. We have 10,000 people entering medicare every day today. Like, people are basically generally living longer than they were before. So the need of healthcare, like more broadly, is actually going to increase. So this $5 trillion is probably going to become $6 trillion. It is going to become $7 trillion. That is not necessarily the problem. The problem is the fact that, where is it going? Like, it's really not going to the doctors. It's really not going to creating, like I think, like more capacity of care. It's not going to chronic care management. It's not going to hospital at home creation. All of these
Mhm.
things that are going to inherently, like I think, like improve outcomes of care. Where is it going to? It is going to more revenue cycle. It is going to more claims processing. It is going to more chart chase. And if that's basically the things that we are going to put, like I think, like AI to, we are going to yield like incremental outcomes, which basically on paper would look like, hey, we did AI, like, but nothing's really going to change any in any meaningful way, shape, or form. So I think, like, the biggest thing that is needed is for people to have courage, like, is for people to start thinking about the fact that we are going to reshape how healthcare basically looks like. And we are working with some of the largest basically health systems in the country, where, like I think, like we are seeing CEOs and chief operating officers and CFOs saying that this is just not working, like, for us, and we need to reshape, like I think, what healthcare looks like. We need to really start thinking about what is a modern chassis on which we run, like I think, like healthcare. And if that's basically going to be the intent, we will have courageous leaders effectively, like I think, take up the leap and really differentiate themselves in terms of creating what is like a modern autonomous healthcare administrative, like I think, like framework, which then will get them to basically be perceived better by patients, be perceived better by the bankers working with them. Like, cost of capital is basically going to get lower for them. All of these good things are going to happen to leaders who take up the right approach towards this, think of this as a systemic transformation exercise, set up the right context infrastructures in place, think about transformation in major areas, and then basically, like I think, like deliver value to their patients and other stakeholders in general as well, rather than thinking about, hey, like I think, like we did AI in 250 places and like nothing changed.
Mm-hmm. Yeah, and that's what like most organizations are seeing today. Like they're buying AI, but most of that AI is not showing measurable ROI. And I think you said it right. Like people did not join healthcare to chase charts or do coding. Like they join healthcare to care for people. So in some like way or form, we'll also need believers who believe in like this new way of working with AI and um, can essentially like transform the way things work today, all the way from process to technology. Are you seeing like the top 5% organizations who are able to see ROI from AI? Like what are they doing different?
I'd say like I think like they are starting to think about what their organizations look like 3, 5, 10 years out, right? Like they are starting to think about the fact that like in any investment, let's say like I think like I'm an entrepreneur, I've raised series A, series B, series C, series D, whatever, right? Like if I go to a series A investor and effectively like I think like say that and if they are like I want to basically like I think like get everything basically as a return in 3 months, right? Okay, great, like I think like you'll see 20% return, like but who cares, right? Uh, all great things will basically like whether you're basically creating these multi-billion dollar companies, whether you're creating systemic changes which transform enterprises, etc., they have to be thought about in a transformative like way over a longer term period. So what is ending up happening is that a lot of leaders who are taking short term approaches towards it, who are trying to basically make here is a quick fix here, here is a quick fix there, like they are not necessarily seeing like I think like ROIs come to it. But people who are effectively like I think like starting to think about, okay, I will set up the infrastructure, I have the data effectively like I think like running, let me start basically compounding this over a period of time. Like I will create like some degree of value creation in one area, let's say automated care coordination things today. Then I will basically start thinking about engaging my providers like in a very different way, deliver better clinical decision support to them. That will then basically like I think like lead to transformation in what the provider needs to do, because I can do automated like scheduling, I can do automated referrals, etc. And suddenly like I think like five things stitched together, you've created maybe like 100 200 million dollars of like I think like earnings differential for yourself,
Yeah.
right? But if you think about these just as basically like I think siloed pieces, that I'm going to buy scheduling AI, I'm going to buy referral AI, I'm going to basically buy like coding AI, etc., none of these things basically have shared context. The patient is getting now inundated with five different like things. The provider is basically like I think like even more burnt out, because you're now asking them to go look at some evidence somewhere, and some like I think go do scribing somewhere else, and like get coding from something else, refer into a different like I think it's just
Yeah.
crazy. Like why would you basically want to like I think like create even more fragmentation for both your patient and like your provider set? So I think like the way we are sort of really seeing the more evolved and deeper thinking organizations are where they are sort of really going and saying that like this is a 2 3 5 year like I think like journey of transformation for us. There are going to be steps in that journey. We are going to work with like someone who can help us basically take through those steps, and we are going to build all of these things like and transform our organization over like a period of time. That yield is going to be so much larger than what like I think like anyone else is basically going to get. Like because compounding, like as Mr. Warren Buffett says, compounding
Mhm.
has its way to like I think work, but you'll have to basically give it time. So that's basically like I think a little bit of my view on how things would evolve. And the people who are going to win in this entire thing are going to think, be systemic thinkers, and think about transforming their organizations holistically, rather than basically like I think like chasing the media hype and really getting like just the one thing right, like that these many doctors use some form of AI. Doesn't really matter.
Yeah, yeah, makes sense. And like in some ways, just like buying disconnected point AI solutions will also create more downstream cost. because you'll have to spend time and money to get it to work together. And what you're describing is almost like a flywheel or a compounding machine where every AI solution that you implement will create the funds to buy the next one and like create the next one, like so, and so on, like the flywheel essentially. um, I have a feeling that like a lot of people will have this question where there's obviously pressure from like their leadership or the board to create more value using AI. How do they balance uh, showing like short-term value with like a more long-term approach? Do you have thoughts on that?
Yeah. No, I think like the way to sort of really like I think like do this like is what we've sort of we've been saying to our customers is that just think of these two things. They're not like mutually exclusive like I think like things, right? Like let's say we are setting up like I think like an infrastructure, we can effectively like I think like go ahead and say that this is the first two areas in which we will create value. Pick up the things that create value like I think like quickly as the first basically things, but don't do that like in a silo. Like do all of it like I think like on a common infrastructure, like that I will make sure that everything is happening in a common infrastructure sort of like way, but I will pick up the things that create value first. Like where I'll give you examples, right? Like I think like some of our customers are starting to think about creating massive degree of care coordination capacity, like so that their value based care programs could generate like I think like hundreds of millions of dollars of gain. Some of our other customers are basically thinking about practice transformation like I think like as the first step, where they can basically create like I think much more stronger aligned clinically integrated like I think network, and inherently like I think like driving massive degree of transformation on the revenue cycle processes and reduce the cost of revenue cycle for them like by tens of millions of dollars. So these are all very real things to do today. uh, uh, and then like I think but once you've done that on a common chassis, and if you transformed the practice of it, or if you transformed care coordination, you can also run chronic care management on top of it, you can also run utilization management on top of it, you can on the practice transformation you can run all of revenue cycle on top of it tomorrow. So if you think about this like in a structured compounded like I think like way from a technological perspective, there is a lot of long term value that you can derive out of this while still basically winning the short term.
Mm-hmm. Makes sense. And like I think historically, when people have thought about like these chassis or these platforms, it has taken them years and a lot of spending to implement platforms. Like how can they approach like this unified context infrastructure differently?
Yeah, I think this is a problem that we've sort of really been spending so much time, effort, and like I think like to the dismay of my board, like I think like money on like we've spent basically like I think like what now like I think like close to $500 million basically like I think like trying to automate what a lot of that like context infrastructure creation process looks like. Like you're right, like I think like if we even rewind back like a couple of years, 2 3 years, um, it used to take you like I think like anywhere from 12 to 18 months to create like I think like any degree of context infrastructure, right? Like in the more recent basically like deployments that we've been doing, it's like I think like now compressed to like I think like 3 4 months like I think period, right? Like so we are getting faster, better, like more automated in doing like some of these things like at our end, for sure. It's not an easy process by any stretch of imagination, but like I think like we are investing very very heavily like I think like to make sure that in a margin strapped environment of health systems, people are not able to basically take multi year infrastructure creation like I think like projects. So what can we do from our standpoint to effectively like I think like do this in a 3 month period, like uh, hopefully like I think like 45-day period like in the future as well. It's hard, but like I feel like I think like we are now at the point in time where we can get the base infrastructure running probably in anywhere from 6 to 12 weeks, and not 6 to 12 months.
Mm-hmm. Yeah, and I think I've seen our team do this, but essentially, like not too far back. it would require a human to look at the data model of like an EHR or any other system that we are integrating and map like every field manually. But now with AI, like some of that work can be automated so easily, and this is the accuracy is so good. So yeah, it makes sense. Like the speed of implementing the context infrastructure is going to like become like shorter and shorter in some way or form. Um, all right, awesome. So you opened with something important, like the healthcare is about people taking care of people, and AI's real job is to clear away like all of the administrative burden that pulls them away from delivering that care. For everybody who's like joining us for the next 2 days, what's the one thing that you want leaders to take away from the conference?
I think my general view is, for the first time in multiple years that I've been building out the business, I just see basically there is a lot of hope and uh, around the block. Right, like everyone's sort of really excited about the fact that there is something transformative here. Right, like so our intent, like I think, like as you remember, like I think, like doing this, right, like was the fact that we can get the best of the best from across like the industry share what they are thinking about. Right, it's going to be a incredible learning experience like across the board. We are sort of really like very excited to learn ourselves, right, like because these are leaders at incredibly large organizations, thinking about what their strategy around AI is going to look like, what are problems that they are trying to solve, what are the good bad ugly of all of these things as they're going through these transformative exercises. So what I'm like I think like looking forward to is um, these leaders effectively like I think like sharing all of these experiences and being like an incredible learning experience for all of us, like who are joining in.
Mm-hmm. Yeah, amazing. Thank you, Abhinav. That was an engaging conversation, and I hope everybody takes away like that valuable learnings from the next 2 days. And welcome to Context, everyone. Abhinav, thank you again.
Thank you.